It's a very challenging question. I will say the biggest mistake you can make is being aggressive or attacking them. And unfortunately, that's most people's gut instinct, is to be aggressive and attack somebody whenever they're vehemently against their behavior. The problem is you have to recognize that they are making the choice to engage with this substance, and your best bet is helping to unpack and understand why they're doing that, figure out whether or not they've developed an addiction, i.e. it's starting to replace their identity and their life is starting to revolve around that particular thing, and then figure out how and why you got there and get them into treatment. But when you're aggressive, when you attack somebody about it, you shut down conversation. When you shut down conversation, they hide the behavior. When they hide the behavior, you can't fix the behavior. I tell my patients all the time, I get urine drug screens because I'm legally required to, and I want to make sure that you're not diverting any treatment that you're getting, such as like buprenorphine or Suboxone. But at the end of the day, I want a relationship with you where you just tell me if you used. Because if it's adversarial, if you're trying to hide something from me, I can't help you. Whereas when you tell me, it can always be a conversation. It's not that I'm necessarily condoning the behavior. That's not what I mean by making it a conversation. But when it's a conversation, you can get to the root cause. When it's not a conversation, when it's browbeating, when it's beating somebody over the head, it's not a conversation anymore, and you can't get to the root cause. When you can't get to the root cause, you can't fix it. So again, I think the biggest thing is developing that relationship where it can always be a conversation. When things are a conversation, and somebody who's struggling with substances feels comfortable having that conversation with you, when they have cravings and desires to use, when they feel triggered, they'll tell you, and then you have an opportunity to intervene. And that is indispensably important, because you intervene once or twice, they use once or twice, you intervene 2 or 3 times, they use once or twice, you intervene 5 to 10 times, they use once or twice, and eventually it gets better. But when it's a conversation, again, you have the opportunity to change something. From a medical perspective, it's always very important to try and make sure that they're not at risk for overdose. And I think that's probably the first thing on everybody's mind, especially with, unfortunately, how prevalent overdose is, especially in Tennessee. But once you know that from a medical standpoint, they're safe, they're not wanting to harm themselves, and you do harm reduction techniques like helping them to get on medication-assisted therapy, helping them to get to rehab, to detox as needed. Again, the biggest thing is maintaining that relationship where it can be a conversation.